followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning are Dr. James Hildreth, President and CEO of Meharry Medical College, Neely Glenn, co-owner of the Cordell and St. L event venues, and Sherry Franklin, Director of Sales and Marketing at the Renaissance Nashville Hotel. Also with us this morning to help answer your questions are Director Chief William Swan of the Nashville Fire Department, Dr. Michael Caldwell of the Metro Public Health Department, Butch Spearden, President and CEO of the Nashville Convention and Visitors Corp., and Charles Starks, President and CEO of the Music City Center. We're grateful to Mr. Starks and everyone at the MCC for their hospitality today. We'll now begin with Mayor John Cooper.
Good morning, Nashville. It's a pleasure to be here today at the Music City Center, which has brought over 2,000 conventions and event groups to Nashville since it opened its doors in 2013. As we enter phase 3 of our roadmap for reopening Nashville, the Music City Center and other venues are ready to host larger events, while also supporting the health and wellness of everyone who visits Davidson County. Nashville has consistently been ranked as a top 10 outstanding meeting destination in the United States, and for obvious reasons. Our world-class entertainment scene, cultural events, and hospitality industry are second to none. But since the start of the coronavirus pandemic, every major city in the U.S. has suffered from the sharp decline in convention and events industry, an industry that contributes more than $100 billion to hotels, airlines, restaurants, and other local businesses across the nation. But it's particularly important to Nashville. As the pandemic across the country progresses, 9 out of 10 businesses have canceled most or all business-related travel this year. And a majority of employers anticipate in-person events will only resume in the second quarter of 2021. 9 out of 10 convention meetings and other large in-person gatherings have canceled since the start of the pandemic due to customer and staff concerns about health risk. Now, we need those cancellations to be just postponements, and that is only possible if we continue to be safe and be famous for our safety. We are not alone in being hurt. Based on recent figures, total U.S. airport travel is down 69%. In Las Vegas, that number is 70%, New Orleans 70%, Miami 65%, Austin 73%. Airport traffic at BNA is 62%. Now that's better than our peers, but so much less than it was a year ago. The good news is that number is steadily increasing month by month. When people start to travel again, we want them to come to Nashville and enjoy our hospitality as they depend on our safety. Together, we've made tremendous progress. Nashville's events and hospitality industry is on the rebound. Customer confidence in Nashville is growing as our city continues to respond resiliently to the coronavirus. The hard work of our industry is creating a safe atmosphere for our residents and out-of-town guests. Nashville's progress throughout the pandemic is matched by measured changes in our economic reopening plan. Your efforts have made it possible to safely welcome and host larger gatherings sooner rather than later. Now, Nashville can set the gold standard for hosting safe events with healthy outcomes in the COVID era. To do that, we must all remain vigilant in practicing healthy habits, including masks and social distancing. With healthy habits, we can control the disease and any damage to the economy. Just a few months ago, Davidson County was the worst county in Tennessee in COVID-19 infections. As of yesterday, we were 76th in the state. Metro Public Health today is reporting 60 new daily cases this morning. The science-based, data-driven public health decisions we've made here in Nashville is helping to keep both our community safe and drive the state's COVID-19 progress. Shelby County should also be applauded for its efforts to slow the spread of the disease through prudent and necessary public health protocols. Today, the state of Tennessee is off the top 10 worst COVID-19 hotspot list, and that's mainly due to what Davidson and Shelby counties and other counties have done to mitigate the spread of the virus. To put that into perspective, if Davidson and Shelby counties did not institute restrictions, and we're still at the July case rate, the state would be reporting 625 additional cases today, just from Davidson and Shelby alone, and that would put Tennessee back on the hotspot list. And bad national publicity would keep future business away from our communities. Effective local response has prevented Tennessee from being the 5th worst state in the country, and as of yesterday, we were ranked 17th. Now, as of today, Nashville has entered phase 3 of our roadmap for reopening Nashville. Dr. Jahangir will once again review the changes that mark phase 3 momentarily. But I want to take this moment to thank all our local businesses, especially our event venues, hotels, and other hospitality businesses, for their ongoing commitment to keeping Nashville safe. They are leading the way. And we need to honor those Nashvillians who work in these industries. Thank you for your patience, your diligence, and your sacrifice. You are on the front lines of Music City's economic restart. Our city's comeback as a world-class international events destination relies so much on your hard work and dedication to public health. Now, this morning, it's my pleasure to welcome two very important members of our community and our important hospitality industry. Neely Glenn, co-owner of the Cordell and St. L event venues, and Sherry Franklin, Director of Sales and Marketing at the Renaissance Nashville Hotel. It's also a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's here to share his insights as a renowned infectious disease expert and a member of the Metro Coronavirus Task Force. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Task Force. Thank you.
Good morning. Thank you, Mayor Cooper. This morning, 5 of the 8 metrics that we trace are green or satisfactory. The 3 metrics in the yellow are cases per 100,000, as well as hospital and ICU bed capacity. Our 7-day average for cases per 100,000 is 14.7, essentially flat from where we were this time last week. Our hospital capacity is 14%, and our ICU bed capacity is at 13%. This morning, 114 people are in Nashville hospitals with COVID-19. Our doubling rate, or the number of days it takes for this virus to double in our city, is at 185 days. Overall, our numbers are very encouraging. However, it would be good to see the cases per 100,000 get to about 10. This morning, we roll into phase 3 of our roadmap to reopen. The current phase 3 will include the following changes. First, restaurant and bars may operate at 50% capacity, up to 100 customers per floor, and an additional 100 patrons outside. Also, groups of 8 are allowed to sit at a table, and restaurants and bars will close at 11 p.m. Event spaces may have 30% capacity or 500 people, whichever is less. And any event with over 25 individuals still needs to get approval from the Metro Public Health Department. For more details on phase 3 and the roadmap to reopening, please visit our website, covid19.nashville.gov. Now, an update on our community assessment centers. Beginning Monday, the centers will be open from 8 a.m. to 2 p.m., Monday through Friday. This change is based on feedback we heard from residents, as well as with the adjustment for the change in sunrise and sunset times in our city. The community assessment centers are located at Nissan Stadium, at the old Kmart in Antioch, as well as the Meharry Medical College. Today, they are open until 1 p.m., and tomorrow they will be open from 7 a.m. to 1 p.m. But again, effective Monday, they will start opening at 8 a.m. and closing at 2 p.m. Additionally, our assessment information hotline is still operational from 7 a.m. to 7 p.m., 7 days a week. Call 615-862-7777 if you'd like to have any information. And we have operators who speak both English and Spanish. So if you've been in contact with anyone that's had the virus, you have any concern about the virus, you can call our hotline or go to the assessment center. Now this morning, we are here in the Music City Center. Now before the pandemic, this was a very busy place, bustling with activity, like many of the other venues here in Nashville. The last time that I was in this building, at the very beginning of the pandemic, the activity I witnessed was people working to make this a 1,000-bed COVID hospital. I am so glad to be here today as we strive to get Music City back to the activities that we had before the pandemic, hosting meetings and conventions. But remember, for us to do that, we must stay vigilant and stay focused and stay the course. We've entered phase 3 and we have opened up more. And this is great. We've come such a long way. So please don't let up, Nashville. Remember, stay at home when possible. When you go out, wear a mask, socially distance, and wash your hands. And if you feel like you may have the virus or you're concerned about it, get tested. I really appreciate what everyone has done. And remember, we must continue to stay vigilant against this virus and continue the behaviors that have gotten us up to this point. Again, with all my gratitude, Nashville, I'd like to introduce Dr. Hildreth. Thank you.
Good morning, Nashville. Fall has begun, and we're now several months into the COVID-19 pandemic. While there's a great deal that we still don't know about the virus and its biology, there's a great deal we do know thanks to physicians, scientists, public health professionals around the world. We know that this virus causes respiratory diseases, as does its close cousins, SARS and MERS, that caused pandemics earlier this century. But this virus wreaks havoc throughout our body, including the gut, kidneys, heart, and other organs and tissues. We know that while the virus itself can cause significant harm to our bodies, the immune response to the virus can also contribute significantly to the disease. The good news is that even though we don't have a proven treatment for COVID-19, because of the efforts of physicians who refine and tweak the treatment of the virus, we can now reduce the likelihood of death significantly. And that's a great achievement by our physicians, and we owe them our gratitude. In the early days of the pandemic, there was a great deal of uncertainty regarding how this virus is transmitted. We now have a great deal more clarity about that issue. Not only is the virus transmitted in large droplets as a result of coughing and sneezing, we know that this virus can be transmitted by having prolonged conversations with someone who might have the virus who's asymptomatic or pre-symptomatic. And this is likely the basis for super spreader events, such as weddings, large parties, or other large inside gatherings. Because of the work of global scientific community, there are more than 200 COVID-19 vaccines that are currently being evaluated in some place or another. And 11 of these vaccines are now in phase 3 trials. And by the time they're fully enrolled, there will be at least 300,000 volunteers around the world helping us to evaluate vaccines. It's likely that at least one of these, if not more, will be approved by the FDA in the next several months. And this is extremely good news and holds the promise for allowing us to achieve herd immunity and to get back to a new normal. Another thing that we know about this virus is that the risk of spread is much higher inside than it is outside. This is especially important that we keep this in mind as we move into the fall, where we're going to be doing a lot more things inside as opposed to being outside. And thankfully, there are things that we can do to limit the spread of the virus as we move back into our inside activities. We know what they are: wearing face coverings, washing our hands or sanitizing them frequently, avoiding large crowds, and maintaining social distances. So we can do something close to herd immunity. I call it herd resistance. Herd immunity refers to the fact that if at least 60 to 70% of us are immune to the virus, the likelihood of spread throughout the community is much lower. And in fact, we can achieve elimination of the virus. So if 60 to 70% of us do the things that we need to do to resist the virus, it can have the same effect, but we all have to do it. We can achieve herd resistance, even if we can't achieve herd immunity. And that will be achieved by all of us doing the things that we need to do to mitigate the virus. As you've heard from Dr. Jahanger, 5 of the 8 metrics that we follow for reopening are in the green. And as mentioned before, when activities inside ramp up, there is a great danger of a surge in cases. So we have to be especially vigilant as we start the fall to make sure we don't let that happen. And it doesn't have to happen if we stay on top of the virus. So the other thing to mention, of course, is that we're starting flu season, and the likelihood of having a significant flu season is high this year. So we need to ask everyone who's willing to do so to get a flu shot, because the prospect of having a twindemic of flu and COVID-19 is kind of scary. And please keep in mind that it's possible to get both viruses at the same time. They use two different receptors to get into our cells, which means that both viruses can infect us at the same time. And since they both cause respiratory disease, having both viruses in our bodies at the same time could be quite challenging. So Nashville, we've got this, we've had it, let's keep it going. Hand washing, face covering, social distancing, avoiding large crowds. We can keep the virus in control. Thank you.
Thank you, Dr. Hildreth. And now I'd like to welcome Neely Glenn, co-owner of the Cordell and the St. L event venues.
Thank you so much, Chris. And I would like to thank the mayor and the health department who have worked so hard to get us to this phase 3. We are so grateful. And I want to assure you that we plan to do this safely. We have put in high-end air purifiers in our venues. We will be taking temperatures. We will be utilizing the stand-up, mask-up protocol. So I want you to know that we are here as your partners to do this the right way. I also want to say thank you as a small business. Obviously, these last 5 months have been very difficult for us because we have been virtually shut down. So by allowing us to be in phase 3, you will allow all the vendors that we work with to survive. The caterers, the florists, the photographers, we now will have an opportunity to get back to work and to do it safely. So again, thank you so much for helping us get to this place. We want you to know that we are here as your partners to do this safely, and we look forward to allowing our community to come back to a place to safely celebrate. So thank you so much. And now I'd like to introduce Sherry Franklin from the Renaissance. Thank you.
Thank you, Mayor Cooper, for the opportunity to join today. And then secondly, we'd like to thank you for all of the protocols that have been put in place for this past 6 months. We all want to ensure a safe and healthy environment for all of our visitors as well as our citizens. The mask mandate has proven to work, and it has allowed everyone to be as safe as possible while we still conduct business. As we take a look at the city of Nashville, Nashville's hospitality industry has been the economic driver to the city, providing jobs, tax revenue, and economic impact throughout the city. Conventions and meetings make up 37% of visitor business, and it has been virtually zero since mid-March. We have all cleared our books. We have hosted meetings maybe up to about 5 to 25 people. But other than that, we have not hosted. We cleared all of our books for any major meetings. So we appreciate the city's protocols and careful reopening. And our customers are very appreciative of that, as well as they are very cautious. What phase 3 means, the difference between groups canceling their meetings in the spring and the next 6 months, but it also gives us the opportunity to book new meetings into our space. With the cap of 500 attendees didn't mean that we turned the switch on last night or this morning to bring meetings. 500 people, it takes a lot of months to plan those types of meetings. So our reopening affects what we can book over the next 6 months, as well as what we can retain for the next 6 months. On a positive note, our hotel hosted a meeting up to 125 people, thanks to the health department for working with us and approving that meeting. It was great to see our operations team back of house working again. That meeting felt like 1,000 people. It was only 125, but we were excited about that. And we do have a group in-house today that's upwards of 125 people. The local planners thought that they might have a few more, and the Board of Health, thank you again, approved us going up to 200 people for that particular meeting. I know that our Music City Center is currently working with a citywide for January, that group would accommodate multiple hotels. And so they're working as we continue our reopening guidelines to finalize their numbers. So that's good news for us. But why is this so important that we take steps to carefully bring back meetings and conventions? It's the ecosystem of the hotels. It's where we're currently sitting and standing right now in the Music City Center. It's our event venues, it's our restaurants, and it's other areas that depend on meetings and conventions. It's 71,000 jobs that in the hospitality industry pre-pandemic. We're employing your friends, we're employing your family members, we're employing your neighbors, all fit into that 71,000 people. For my property to date, we still have the majority of our management team on furlough. But as we enter into phase 3, that means we can bring more workers back. We don't ever want to put the health of our citizens, our employees, as well as our visitors at risk. But we also want to build a foundation, rebuild that foundation to bring conventions back and be competitive as the industry and the country rebounds. So thank you again to Mayor Cooper, the Health Department, Music City Center, and the Convention and Visitors Bureau for working together to start bringing back our meetings industry in a careful way, and then the protocols that have been put in place. So to everyone, please stay safe and wear a mask.
Thank you, Ms. Franklin. We'll now start with media questions, beginning with Dennis Ferrier at Fox 17. Good morning, Dennis.
Good morning, Chris. Thank you so much. My question is for the mayor, and it's knowing that 50% occupancy in restaurants is an untenable number. It's been described as a ticking clock to bankruptcy. And also knowing that the restaurant numbers are so low, why not move them to 75% occupancy as you did in the original phase 3 back in June, just to encourage their survival? And of course, at this moment, we have 20 restaurants, cafes, and bars that have closed because of COVID. And this might stem those losses. Thank you so much.
Thank you. Mayor Cooper.
Thank you, Dennis, for that question. We are always examining how to add capacity back as our health numbers improve. That is a daily question. We hope to be able to add capacity back. Nashville has been very on a plateau the last weeks. We're hoping for a breakthrough as we add additional health capacity right now. We do pray that we stay at a plateau. We can control the disease and control the damage that it does to our economy, but we have to remember to continue all the safe habits that got us to this improved condition, and we are happily going to increase capacity as we can. The 50% capacity up to 100 people, again, the 50% capacity often is based on kind of a fire code capacity, not necessarily what a restaurant needs, but we're in daily conversation with the industry, and we are hopeful that the city's producing the health results that makes even additional incremental capacity available and get back to normal. Now, customer confidence is an important part of this. It's not just capacity. You need those seats filled by customers who are feeling safe and want to go out to dinner. It is the decline in spending by the top quartile in services that has driven the recession. Those spenders are very healthcare choice driven, and they need to feel safe before they come back. Now, that is a broad category. Is that different parts of the hospitality industry responding to that and serving that? But that is overall true, that the big gains will come when people, regular people, feel like it is safe to go out to dinner. And I'm excited about our ability to demonstrate that safeness so that people should not have a concern, and it should not restrict their spending patterns. But there is a little bit of a chicken and an egg problem here going on. But the short answer to your question is we're excited to get that number up. And when our healthy habits provide additional capacity to any industry in Nashville, we are beyond excited to add to it.
Brett Kelman at the Tennessean. Brett, you're on the air. Brett, can you hear us? Let's try coming back to Brett after Julia Palazzo, WKRN. Julia?
Hi, Chris. Thank you. Just a couple of questions. Mayor Cooper, I know you addressed this briefly yesterday, but the developing situation with the Titans getting more positive cases. Just wondering how your office will be working with the team moving forward, especially if more positive cases come out. And of course, the NFL not deciding yet when to reschedule the game. And Dr. Jahangir, just wanted to get your reaction on Governor Lee lifting restrictions on all businesses and gatherings in the majority of Tennessee's counties. Are you concerned that we will go back to how we were in May when all of these other counties were reopening before us, and Nashvillians traveling to these other businesses? How will it affect our businesses and the status of COVID in Davidson County? Thank you.
Thank you. Mayor Cooper.
Thanks. Let me start with the first question. Talked to the Titans yesterday. You know, this is not unexpected in all sporting events. These things happen. I think it's just going to be a temporary setback. The public health plan was a very good one, and I think can go forward when the team and the league authorizes them to do it. Think of it this way. There is a staff outbreak. Not any different than any other hospitality provider. Our job and the health plan was always keeping the public safe to prevent a staff outbreak from being a super spreading event through the public. In some ways, the potential for this was always anticipated in the plan. The public was never going to be exposed to a staff outbreak. No one was ever going to be near that in any case. But I applaud the Titans and the league having an additional level of safety. I am personally disappointed because I thought it was a marvelous moment for Nashville to demonstrate to the country that you can go forward with activities and be safe if you're following expert protocols. I think that demonstration will have to wait for a little while, apparently with today's news, but it is a great moment for Nashville to take its place in demonstrating that you can do it. We're going to have the virus with us for many more months. We need a vibrant economy. We can manage this, Nashville. We can control the disease and its effect on the economy and do it one case at a time by excellent public health protocols. And I'm so grateful to the Titans and the whole hospitality industry that is showing national leadership in this hard time about how to do it and do it right. Not that there will be setbacks. And obviously, this is a setback today.
Julia, thank you for your question. So listen, I've been given the opportunity to serve as chair of the Board of Health here in Nashville. The mayor gave me an opportunity to help with the coronavirus response in Nashville. Because of our ability to impact different sectors here, and I know it's been hard the past 6 months, today we are rolling into phase 3. We are averaging 14.7 cases per 100,000, making us the 76th worst county in Tennessee. 76th out of 95, right? And I bet you we're not that far from being the worst in spread, 95th, or like the best in the whole state. As the mayor said, if our numbers were where they were at our peak, we would be the 5th worst state in the country for this disease. We are now 17th worst in the country. And if you look at what giving the ability to our county mayors around us to put mask mandates in place, I think was very helpful. And if you can see the numbers in our surrounding area went back. Now, go further west, near Madison County and go north of Madison County and look at all the places that are above 25 per 100,000. Look at the fact that our assessment centers, which last quarter conducted 75,000 tests, had 18% of those tests conducted by people who don't live in Davidson County. This virus is around our state. We had a pretty big problem here in Nashville that I'm proud of what we've all done to get it under control. And I'm proud of the fact that we're opening up industry more now and event spaces. Ironically, today was supposed to be my national organization's meeting here in Nashville in this building, right? So I'm proud that we can reopen Nashville because of the hard work we've done. So I can tell you about Nashville. I'm proud of what we're doing. I think allowing local governments to continue doing what we feel is best for our community is critical. And just remember of the progress that we made here in Nashville. So thank you.
Stacey Case at Fox 17. Good morning.
Good morning. Thank you all. First, congratulations on all the progress. I do have a couple of questions about the metrics. Some in the hospital industry say we don't normally meet the 20% available beds in normal times, and they say this is an unreachable and unrealistic metric. Do we need to rethink this metric? And any more thought on pulling prison cases from the new cases per 100,000 in the event that we have another spike at prisons?
Thank you, Stacey. Dr. Jungier.
So I want to tell you where that 20% came from. That 20% number is the number for green, yellow, and red that we have. It's the same number that the state HERT system uses. Okay, so it is transparency of what the state HERT system says. I agree with you. Somebody who has administrative roles at a hospital, hospitals are rarely at 20% empty. And as you notice, we also give you the number of patients in our Nashville hospitals with COVID. Now, if all of a sudden it's important for us to follow those trends. I think the fact we're rolling the phase 3 and the 2 hospital metrics are in the yellow section. Again, a number set by the state for their metrics should demonstrate to you that we're not looking at just an isolated metric. So I hear what you're saying. I disagree with your presumption that is a key metric in isolation that we use. We use all our metrics to drive forward. But I think it's an important metric for consistency and transparency for you to know how much bed availability is in our region. And equally as important is know how many patients are in those beds with COVID. So there's been no secret as to that. And I think that's an important one for us to continue to give to you from day one. Now, regarding the prison number, right now, 0.2% of our cases in that 14.7 are from correctional facilities. When we had the outbreak of a few weeks ago, I believe in the press conference last week, I mentioned it dropped our number by 1. So it was like 15 to 14 or 14 to 15. I'm happy to be transparent with you and give you that number if we have another big outbreak. But that number was all washed out pretty quickly. It's a 7-day rolling average. So I think best public health practices will show you that those numbers in other communities do include prison numbers, but I think it's fair to make you aware of what that difference is without that, and pull a county random here, a county random there that excludes those numbers in their isolation is probably not best public health practice. So we'll continue doing that. And again, if we have another outbreak, I'm glad to give you the number with and without that. So thank you.
Blake Farmer, WPLN. Blake.
Thanks for calling on me. My question is about how long the city can sort of keep up the testing that is occurring. And it's sort of a 2-part question here with schools going back. I know you're changing the hours to 8 to 2, but that's right in the middle of school hours if you needed teachers or students who needed testing. Is there a plan to make testing more available around the school schedule?
Thanks, Blake.
Thanks, Blake. So what I'm proud of is our community assessment centers have tested, I think, 150, 175,000 people. As I just mentioned, the last quarter, we just got these numbers yesterday, 18% of those people from out of county. The 8 to 2 hours, you're right, are not very, students and teachers who may have concerns, those hours are not great. That's why we're working with Metro Public Health, Public Health is working with the schools, and we have multiple mobile sites that are being set up at wherever the schools feel makes most sense, and hours that are beyond the 8 to 2. Additionally, there are mobile tests that are available, mobile centers that are available for the public as well throughout the city. I think next week, or there's 3 that I saw on the calendar already that are typically start at 3:30 and beyond, and the public health website will make sure we have that updated. So long answer to say, we'll continue testing, doing the community assessment sites as long as we're able to do that. And we'll let you know if for some reason we're not, and why that isn't, and there's no reason to cut those right now. And the school partnership to get mobile testing at schools is moving forward, as we announced a few weeks ago. And there are a lot of plans being laid out as we speak about when and where that happens. So thank you.
Can we try Brett Kelman one more time at the Tennessean? Brett, are you there?
Hey, can you guys hear me this time?
Yes. Good morning, Brett.
Fantastic. I have a 2-part question about testing. First, the White House recently announced that there would be 150 million Abbott Lab mobile rapid tests being disseminated across the country. I'm curious if the city is getting any of those. And then secondly, there have been a lot of developments in saliva testing as compared to nasal testing in the last month. Saliva tests are generally less intrusive because they don't have to stick that swab way up into your brain. I'm curious if the city, particularly Dr. Jahangir, expects saliva testing to become any significant part of the citywide testing strategy in the not so distant future.
Thanks, Brett. Dr. Jahangir.
Yeah, thank you, Brett. So saliva testing, yeah, seems really great. It has not, to my knowledge, passed FDA approval yet on a mass scale. If it does, and if it makes sense, yeah, it makes a lot of sense. It's less invasive, it's cheaper, from what I understand the prices will be. And if it becomes available, absolutely, I think that is a way to go and makes a lot of sense. If you notice, we have changed from when we first started 6 months ago, we were doing the nasopharyngeal swabs, and now we're at the anterior nares. So the easier we can do this for people, the better. Regarding the Abbott test, I have not, and I was just confirming with my colleagues, Dr. Caldwell, we have not heard of the city receiving any of those. I know the federal government's passing them to the states, and I believe the governor yesterday mentioned that the schools will get them. We have not received any plan of how that'll be distributed, so I'd ask you to please ask the state that. One correction also is, I mentioned in my previous question, I said 0.2% of cases are correctional facilities, 0.7% currently. So I just want to make sure I corrected that. So thank you.
Just want to make a comment about the antigen test that's getting so much attention. It is 97% sensitive, which is really fantastic if you have symptoms. So that means that the PCR test, which is exquisitely sensitive, even if you don't have symptoms, needs to remain the sort of gold standard for diagnosis. The rapid test is great for surveillance and making sure we can do daily screening of individuals, but please keep in mind that its sensitivity is highest when there are symptoms, whereas the PCR test would be positive even when there are no symptoms because it's so sensitive. That's just something we need to keep in mind. Thank you.
Thank you, Dr. Hildreth. Thank you again to the Music City Center this morning for hosting us. Thank you to Neely Glenn, owner of the Cordell in St. L, to Ms. Sherry Franklin, Director of Sales and Marketing at the Renaissance Nashville Hotel. The next Metro COVID-19 briefing will air on Thursday, October 8th at 9:30 a.m. Appreciate everyone for joining us. Please stay safe.